Assalamualaikum warahmatullahi wabarakatuh and good evening everybody.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, good evening Duta BPJS Kesehatan all over Indonesia. Welcome to the INDC or Initiative National Debate Competition 2024 Top 8 for the evening session. I hope you guys ready for today's debate. Because we will witness an interesting match between Team Super Balikpapan versus as the affirmative house versus Team Sandstorm as the negative house. This is your third round, isn't it? For this year's match. So I hope everyone is getting better and better with the debate and give the good show for the adjudicators and for the audience. First, I would like to introduce myself again, in case if you guys just meet me this match. My name is Siti Sakila, or you can call me Sasa for short. I'm from the Human Capital Management from the headquarters. I will be your moderator and I will lead this session until the very end. I'm also with Mbak Laras as my co-moderator and Mbak Anggi from Corporate University to help me operate this Zoom session. And then I would like to say hi to our honorable adjudicators for tonight. The first is Bu Dena. Hello, Bu Dena. Can you say hi to the audience?
Hello, hi everyone. Great to see you tonight, and I expect a super performance from all of you.
Thank you, Bu Dena. Next is I would like to say hi to Mr. Subkhan, Pak Subkhan. Hello, Pak. Can you hear me?
Hello, good evening, everyone. Enjoy your game and good luck.
Thank you,
Be the
Pak.
best. Thank you.
Last but not least, I would like to say hi to our adjudicators, Pak Rahmat Hidayat. Hello, Pak.
Hello, good evening, everyone.
Do you want to say something to
Enjoy
them,
this
Pak?
day tonight.
Okay. Thank you, Pak. I would like to say thank you to our adjudicators for joining this session actually early from our scheduled time. And thank you for giving your precious time for INDC. And then I would like to say hi to the houses. And I would like the speakers to introduce themselves for the audience this time. The first team is Super Balikpapan. Hello, Super Balikpapan.
Hello.
The first speaker of Super Balikpapan. Can you introduce yourself and say something to the audience and your opponent this time?
Good evening, everyone. My name is Nadia. I'm the first speaker.
Thank you, Mbak Nadia. The second speaker, the time is yours.
Hello, my name is Lutfia as the second speaker.
Yourself.
Thank you.
Okay. I think Mbak Sasha's screen is freezing. Next, let's hear the introduction from the third speaker of Affirmative House.
Hello everyone, my name is Putri Amaliani as the third speaker. Thank you.
Thank you, Team Super Balikpapan. And moving on to the negative house, we have Team Sandstorm. Hello, Team Sandstorm.
Hi.
Okay, here we have the first speaker of Sandstorm. Can you please introduce yourself and say something to everyone?
Hello, everyone. Good evening. My name is Utami. I hope we have a good match tonight. Thank you.
Thank you. And next is the second speaker of Sandstorm. Please introduce yourself.
Hello everyone, good evening. My name is Rizky as second speaker. I hope we can have an enjoyable match together. Thank you.
Thank you. Next, let's hear the introduction from the third speaker of Sandstorm.
Hi, good evening everyone. My name is Nisa. Nice to meet you all.
Okay, nice to meet you too. Okay, I also want to say hello to all the audience in the Zoom meeting. To all the audience, the chat box is all yours. So please spam the chat box with all your supporting messages for both teams. Everyone is open to give your support and cheers to your favorite team. But remember, it's a safe space, so please keep it positive and be kind. Before we start, allow me to read some small rules for all participants. The first, no participants are allowed to open their microphones before their own turn. Second, team members must rename themselves with format team name _ first, second, or third. And third rules is each team member joins with their own Zoom account and not allowed to join in shared account. And the fourth, the operator may do necessary things to make sure that the session runs smoothly. That's it for the rules. I need to see the.
Hello, everyone. Am I back?
Okay. Yes, you are back, Miss Sasha.
I'm sorry for the inconvenience. Okay,
I was
the introduction.
about to read the
Motion for today. Okay. So I will read the motion for today, but I hope both teams already prepared for this. So the motions for tonight is that this House believes that the National Health Insurance Program, or JKN, should cease providing coverage for elective surgical procedures. I hope everyone is preparing good materials and data and good debate for today. Are you guys ready? Okay, that's the spirit. The first chance of speaking will come to the first speaker of the affirmative side. Are you ready? You have 3 minutes. We will wait the timer to be set. Okay, you can see the timer on your screen in the corner. Your time begins once you start speaking.
Good evening, Honorable Adjudicator, Moderator, Negative Group, and all audiences. This House believes that National Health Insurance Program should cease providing coverage for elective surgical procedures. Let me first define our motion. What we mean by National Health Insurance Program is government programs that aims to provide comprehensive health insurance for every Indonesia citizen administered by BPJS Kesehatan. According to Cambridge Dictionary, to cease means to come to an end. And elective, in medical context, means treatment done at a time chosen by the patients. According to UK National Health Service, elective surgery is non-urgent, unnecessary surgery. So, we determine elective surgery as non-time sensitive surgery, which if delayed, won't worsen the disease outcome or surgical complexity on otherwise healthy patients. We believe that ceasing to cover elective surgery will first protect National Health Insurance Program sustainability. Second, improve promotive and preventive role of primary healthcare. And third, ensure appropriate resource allocation, prioritizing essential and critical care. According to Schramm et al., in Lancet Global Health Journal, 28 to 30% of all global health expenditure are related to surgery, while around 11% of them are unnecessary. Meanwhile, at 2024 BPJS Annual National Strategy Meeting, BPJS Kesehatan Director Professor Ali Gufron stated that BPJS are projected to enter deficit state by 2025. Meanwhile, we already reached 97% national membership coverage, showing saturated membership premium collectability, dominated by third-class membership with the lowest premium. This data raise concern of the burden of elective unnecessary surgery on our National Social Insurance Fund, threatening the sustainability of the program. Study by Du Bois in 2016 stated that in the U.S. healthcare system, unnecessary elective surgery were performed mostly because of patient requests, access and availability to treatment, and financial gain. This creates a disparity where some people can get unnecessary elective surgery, while some others cannot even access essential life-saving surgery, especially in rural area where medical specialties and equipments might not be as complete. By stopping coverage to unnecessary elective surgery, BPJS Kesehatan can instead allocate more resources to essential and critical surgery, ensuring equity to all elements of Indonesian citizen as mandated by Constitution and Legislation Number 40, year 2004, as the basis of National Health Insurance Program. This is why they strongly believe that National Health Insurance should cease to cover elective surgical procedures. Thank you.
Thank you to the first speaker of the affirmative house. Moving on. Let's wait for the timer first. The timer.
I'm sorry, Miss, we cannot hear you.
Can you hear me now? Okay, your time begins once you
Yes.
start speaking.
Hello, can you hear me?
Okay.
Okay, the next is the first speaker of negative side. Your time begins once you start speaking.
Ladies and gentlemen, honorable adjudicator and esteemed opponent, today we stand in opposition to the motion that the National Health Insurance Program, or JKNKIS, should cease providing coverage for elective surgical procedure. As the first speaker for negative team, I will outline the reason why elective surgeries must continue to be covered under JKNKIS. Based on 2024 business intelligence data for West Java province, data on catastrophic disease, heart disease is ranked first, followed by stroke and cancer. One of the elective operation is non-emergency heart ring installation and chemotherapy for cancer. BI data for 2024 for West Java province at ETL service level, cesarean section, which are elective operation, are among the top 4 most CBG cases. So, eliminating coverage would result in significant participant complaint due to the removal of a previously existing benefit. Imagine the riot it will cause. Coverage for elective surgeries should be managed, not eliminated, to avoid overutilization. For instance, agreement can be made with healthcare facilities regarding the number of elective PACO procedures for cataracts, balancing practice time, claim numbers, and standard times across various hospitals with high PACO trends. This approach is a cost control program. Another example of cost control, as mentioned by the BPJS director in the MTR 2 days ago, is proportional internal referrals payment, not full 100%. It can be 75% per internal referrals. This can save 11 trillion a year. Anyway, sustainability and the deficit issue is back. What can we do? In the Journal of Overcoming the Social Security Fund Deficit for Health Through Improving Governance, in the Anti-Corruption Journal 2020, from the Corruption Eradication Commission, there are recommendations that we can take. The Ministry of Health and BPJS Kesehatan must develop policy to limit benefits for certain services that have a high potential for abuse and incur large costs. Effort to control costs can also be done by limiting benefits. Good practice in other countries that could be taken into consideration include budget limit for catastrophic disease, such as in Thailand, France, and Japan. Imposing disincentive for participants who adopt unhealthy lifestyle, such as smoking and drinking alcohol, would also be used as policy option. Limitation of benefits can also be done by relying on the strength of the health technology assessment. which continually update guaranteed and non-guaranteed coverage and provides alternative courses of action. This is commonly used by Thailand and South Korea. Apart from that, restriction on benefit guarantees can also use the global budget or performance-based budget method, which emphasize the role of utilizing efficiency. Thank you.
Thank you to the first speaker of the negative house. Next is the second speaker of the affirmative house. Your time begins once you start speaking.
Honorable adjudicators, negative house, and ladies and gentlemen, as what my first speaker said before, we strongly believe that National Health Insurance Program should cease providing coverage for elective surgical procedures. From 1945 Constitution of Republic Indonesia in Article 28H paragraph 1 that government guarantee that everyone has the right to live in physical and spiritual prosperity, to have a place to live, to have a good and healthy living environment, and has the right to receive the health service. I would like to remind to negative house that the definition of elective surgery that we use were based on the National Health Service UK classification of non-urgent unnecessary surgery, which can be determined based on 4 factors. First, there are other available effective non-surgery treatment options. Second, there are no visible impact in disease outcome in surgery were delayed. 3, there are no visible impact in surgery difficulty if the surgery were delayed. 4, the surgery is low acuity surgery on otherwise healthy patient. If the surgery mentioned by the negative team, if delayed, can affect the patient disease outcome, then it was not included in our definition of elective surgery. Instead, we argue that by choosing the cover, elective surgery would provide extra spaces for more urgent and life-threatening surgery. Study by Liu in 2020 shows that 20% of surgery in India were unnecessary. Unnecessary surgery can cause a complication and the patient need more time to recover. It will make them have to stop their work and it will affecting their household economy and their livelihood while they actually do not really require to surgery yet. So, by choosing the elective surgery can push the healthcare provider to choose elective, less invasive treatment that would require less recovery time. And then the discontinual and unnecessary elective surgery can coverage to increase the role and the role of primary healthcare. And then the primary healthcare is the true gatekeeper of the national healthcare referral system, where the primary healthcare can promote healthy lifestyle to prevent the surgery cases related to lifestyle choices. So that's why we believe that we need to choose the providing coverage for elective surgical procedures. Thank you.
You still have 18 seconds.
I
Is it
think
all?
that's enough. Thank you.
Okay, thank you to the second speaker of the affirmative house. We are moving on to the second speaker of the negative house. Your time begins once you start speaking.
Thank you, ladies and gentlemen, honorable adjudicator and esteemed opponent. As the second speaker for the negative team, I will build upon the arguments presented by my colleague and further demonstrate why elective surgery should remain covered by JKNKIS. We disagree that elective surgery coverage should be stopped. Instead, we should manage it. We control it, not completely erase it or stop it. In accordance with the book of JKN Deficit, Why and How to Overcome It by Perkumpulan Prakarsa, published in January 2020, recommendation that we can take is effort to maintain sustainability of JKN with a combination scenario could resolve the JKN deficit. There are also several reasons why the elective surgeries should remain covered by JKN KIS. Healthy individuals are more productive members of society. Ensuring access to elective surgeries help maintain a healthy workforce. A worker who undergoes knee surgery to relieve chronic pain can return to work more quickly and with greater efficiency, contributing positively to the economy. And by denying coverage for elective procedure, it can affect lower income individual, increasing health disparities. JKNKIS was designed to provide equitable access to healthcare and including elective surgeries undermine this mission, ensuring that all citizens have access to necessary medical intervention, uphold the principle of universal health coverage, and promote social justice. And I would like to remind the opponent team that BPJS Kesehatan principle is universal health coverage. JKNKIS was established to provide comprehensive health coverage to all citizens, excluding elective procedures contradict the principle of universal healthcare itself, which aim to provide equal access to necessary medical service for everyone. And according to data from BI from the West Java province in 2024, the rate of cesarean section, which is an elective surgery, is among the top 4 most common CGB cases. And by eliminating coverage would result in significant participant complaints due to the removal of a previously existing benefit. And again, I emphasize that coverage for elective surgeries should be managed, not eliminated, to avoid overutilization. For instance, agreement can be made with healthcare facilities regarding the number of elective PECO procedure for cataract, balancing practice time, claim number, and perhaps a standard time across various hospitals with high PECO trend. This approach can cost control program. To address the deficit issue and maintain JKN sustainability, referring to anti-corruption journal in 2020, cost control measures such as benefit limitation can be implemented, include setting policies to limit benefit for services with high potential for misuse and high cost. In conclusion, the economic implication and equity consideration clearly demonstrate the importance of maintaining coverage for elective surgeries under JKN case. So we really disagree that we need to erase it. Thank you.
Thank you. The second speaker of the negative house. Okay, it's time for the third speaker of the affirmative house. Your time begins once you start speaking.
Honorable adjudicator, negative side, ladies and gentlemen. Choosing to cover elective surgical procedure, it might seem like we are not concerned with humanity or are ignoring the patient. However, we have a clearly provide an illustration that the disease is based on the 4 factors that our first and second speaker mentioned. If the surgery mentioned by the negative team, if delay can affect the patient disease outcome, that it was not included in our definition of elective surgery. Study by Rahmat Hidayat et al. In 2020 on the U.S. healthcare system, data from 2008 to 2016 state that people with lower social vulnerability index are more likely to access elective surgery compared to those who are more social vulnerable. This can be caused by the distribution of specialty and healthcare favoring more developed and prosperous are simply because higher income households can afford the time to stop working for surgery, which are not essential. This proves that the choosing coverage for elective surgery would affect lower class people's surgical access, but instead improve their access to essential and life-saving surgery because BPJS Kesehatan can reallocate resource from unnecessary elective surgery more likely to be accessed by highly income households into supporting more widespread distribution of essential surgical access, especially to those in a remote area where not even the essential surgery available. And instead, we argue that by choosing that covered for elective surgery will provide extra space for more urgent and life-threatening surgery. This discontinue of unnecessary elective surgery cover also will increase the role and involvement of primary healthcare as true gatekeeper of the national healthcare. Until June 2024, BPJS reported that 120% of actuarial loss ratio showing marked higher cost per member per month as compared to premier per member per month, the highest since when BPJS Kesehatan just started. And highly cost surgery will contribute more loss to the ratio, preventing national healthcare system to provide more research for urgent and necessary surgery. By all data and research has been done, this house believes that choosing to cover elective surgery will protect national health insurance program sustainability, improve promotive and preventive role of primary healthcare, and ensure appropriate research allocation prioritizing essential and critical care. Thank you.
Okay, thank you to the third speaker of the negative and to the affirmative house, sorry. Okay, Last is the third speaker of the negative house. Your time begins once you start speaking.
Okay, ladies and gentlemen, honorable educators, and esteemed opponent. Now let's revisit and consolidate the arguments made by my colleagues to highlight why continuing coverage for elective surgeries is essential. Everyone, it can be denied that elective surgeries are vital for improving patients' quality of life and enabling them to participate more fully in daily activities. For example, cataract surgery, which restores vision, and joint replacement, which alleviate chronic pain. These procedures are necessary for enhancing daily functioning and overall well-being. Also, elective surgery often prevents the development of more severe health problems as it allows the patients to improve their health before undergoing the procedure. By managing health issues earlier, we can avoid more complex and costly intervention in the future. Furthermore, by delaying elective treatments can lead to increased costs for emergency interventions and extended healthcare. Elective surgeries can mitigate this risk and manage healthcare expenses more effectively. For instance, as my colleagues said before, delaying a gallbladder surgery may result in more complex and expensive emergency care. Ensuring elective surgeries supports economic productivity by allowing individuals to recover and return to work more swiftly. This contributes to a more efficient and productive workforce, benefiting to the economic overall. Ladies and gentlemen, our stance is clear. The coverage for elective surgery cannot be cheesed. Removing coverage for elective surgery disproportionately impacts lower income individuals who may not afford private treatment. The JKNKIS program is designed to ensure equitable access to healthcare services, and removing coverage for elective surgeries undermines this goal. The principle of universal health coverage is to provide essential medical services for all citizens, but if we excluding the elective procedure, it contradicts with these principles and restricts access to necessary care. And the affirmative team argues that elective surgery are not essential and should not be prioritized. There is no way we can agree with this idea. Many elective surgeries, such as cataract and joint replacement surgeries, are crucial for maintaining health and preventing severe conditions. These procedures significantly impact patients' quality of life and overall health. The affirmative team also might suggest that funds could be better allocated elsewhere. However, allocating funds away from elective surgeries will result in higher long-term costs due to increased emergency treatments and management of severe conditions. Efficient management of elective surgery coverage rather than elimination can help control costs. Thank you.
Okay, thank you to the third speaker of the negative house. Next, we are entering the conclusion part. The first house that will deliver their conclusion will be from negative house, and you will have 2 minutes. Are you ready, the negative house?
Ready, Miss.
Okay. Your time begins once you start speaking.
Okay, thank you, ladies and gentlemen, honorable adjudicator and esteemed opponent. In concluding our position on the motion, we firmly stand against this proposition. Our first speaker emphasized the health and well-being benefit of elective surgeries. These procedures significantly enhance quality of life, acting as vital preventative measures that avert more severe health issues. Elective surgeries such as cataract removal and joint replacement are not merely optional, but essential for maintaining daily functionality and long-term health. Our second speaker elaborated on the economic implication and equity consideration. By providing timely elective procedure, we prevent higher healthcare costs and ensure economic productivity. For example, delaying gallbladder surgery can lead to emergency operations that are far more expensive. And by eliminating coverage would result in significant participant complaint due to the removal previously available benefit. Instead, we propose managing elective surgery coverage, not completely erase it, to avoid overutilization through cost control measures such as setting limits and agreement with healthcare facilities. Our third speaker reinforced this point and addressed the affirmative team's argument. The claim that elective surgeries are not essential and impose a financial burden is flawed. Elective surgeries prevent more severe and costly health condition. Ultimately, saving money, efficient management, not elimination, is the key to addressing financial concern. In summary, elective surgeries are crucial for health maintenance, economic productivity, and social equity. Eliminating their coverage under JKNKIS would lead to higher long-term costs, increased health disparities, and a decline in overall well-being. Addressing the JKN deficit through policy adjustment and cost control measure is a far more effective solution. We urge you to reject the motion and support the continued coverage of elective surgeries under JKNKIS. Thank you.
Okay, thank you to the negative house for the conclusion. Next, we are going to hear the conclusion from the affirmative house. Are you ready?
Yes.
Okay, your time starts once you start speaking.
Despite arguments made by negative team, we would like to remind them again that what we define as elective surgery are those procedures who are non-urgent and unnecessary. We already stated before that to prevent the disease to progress into late stage, we can employ the primary healthcare to prevent them and provide more holistic coverage to give them more to choose alternative to make them choose alternative and less invasive treatment. We also believe that that employing primary healthcare system will also prevent them to refer to make unnecessary referral to secondary treatment. Also, we also like to ask you to see the national healthcare system as a whole, not as piece by piece. If we only prioritize giving this national healthcare system to unnecessary surgery, how can we protect those who actually need an urgent and necessary care? That's why this house strongly urge that National Health Insurance Program should choose to provide coverage for elective surgical operation, because this is not an ideal world where we can cover every disease and procedures. As we already stated before, choosing coverage for elective surgery will allow for efficient resource allocation, preventing harmful practice, and also enforcing the role of primary healthcare, but also giving all holistic healthcare to focus more on preventive and provide promotive measures. That's why this house strongly believe that national health insurance should choose coverage for elective surgery. Thank you.
Thank you to the affirmative house. And with that, our debate session is finally over, everyone. Yay! Good job, everyone. You guys use your time very well, and you guys deliver your data and your arguments very well as well. But let's hope that it is enough to make the adjudicators agree with your opinions. Now, it's time to let our adjudicators to have a breakout room to discuss this debate session, and we will come back in a few minutes. To all the speakers and audience, you may get a break, but remember to stand by until the session is officially done. Thank you. Hello, everyone. Can you hear me?
Yes, Miss.
Is everyone here already? And is everyone ready to hear the announcement, the comments and the announcement?
Yes.
Yes.
Okay, let's go. So the adjudicators have been discussed, and it's actually a nice discussion because eventually they agree with the winner, but each of them have 3 different best speakers for tonight. So it's kind of interesting. Okay, the first adjudicators that will give the comments for tonight's session will be Pak Subkhan.
Thank you, Sasa. Interesting match and interesting time for tonight. Elective surgery, yes or no? Why not? Many countries have implemented it. The question is whether our country is ready for implementation, and what thing must be prepared of this to be implemented, and what are the consequences if implemented. So that's the many questions that must be answered. So for the best speaker, I chose the third speaker in negative house. Okay. Thank you, Sasa.
Thank you, Pak Subhan. Next is Budena. Please give your comments and thoughts to them.
Okay, thank you everyone and good evening. As Pak Subhan said, today is an interesting match. I noticed that some of you, there are some things that you have done well. For example, you all prepared arguments, you all have data supported arguments. And also you have defined well, affirmative house, you have defined your motion well, and Sandstorm, you also prepare a well-defined counter proposal. So that was development and improvement from your last debate. What you should have done better. So whichever team goes to the next round, please make me proud for the next round. Whichever team goes to the next round, please do what should you have done better. The first one is better do you should have done a better case building. I told you, I think I told you several times that team debaters should have done brainstorm and case build with all your colleagues, with your supervisors, with your subordinates in your kantor cabang, with your kantor cabang, or even with your friends from other kantor cabang as well, because then you'd be given insights to enrich your proposal and arguments. For example, as Pak Subhan already said before, which one is elective surgery? What kind of elective surgery? What's an examples of elective surgery? For instance, negative house mentioned elective surgery is cesarean section. Affirmative house, you also I know you give counter arguments that say that cesarean sections could be elective or could be life-saving procedures. But then I didn't remember a negative house counter argue that counter argument as well. There's cesarean section. There are two kinds of cesarean section. For example, there's emergency cesarean sections and elective cesarean sections. And also, what you should have done in case building, you should dissect a keyword in your motions. What does cheese mean? Does cheese mean stop now or stop in the next 5 years when the financial stability of BPJS Kesehatan has been reached, or what? This should be defined by the affirmative house. You have the privilege to do that. And what you should have done better is rebuttal, counter arguments. I have not seen many counter arguments in this debate. There are so many points that you could be given rebuttal of, but I don't really see that. So next time, whichever team goes to the next round, please listen and respond. Listen to your opponent's arguments and then respond. You could take notes and cross-check whichever arguments that has been addressed by your argument, by your team member. And for example, Sandstorm said about public chaos. Super Balikpapan could argue with that by how to manage public chaos in case of choosing the coverage. But you didn't address that. At least I didn't recall that. And the last advice from me, to whichever team that goes to the next round, please notice and notify. You should notice what's the strengths, what's the weaknesses of your opponent's arguments, then you notify the adjudicators. You notice whichever arguments that has not been addressed by your opponents. Then you mention that. So third speaker, this is your job. Super Balikpapan, you should, third speaker of Super Balikpapan or a Sandstorm, you could, I'm sure you noticed there are so many arguments that has not been addressed by your opponents, but you did not notice and notify us. And also by the conclusions, conclusion is your last chance to notice and notify the judges about your opponent's weaknesses. Overall, that's my advices. And my favorite best speaker for tonight is second speaker of Sandstorm. Congratulations, Super Balikpapan and Sandstorm. Thank you.
Thank you, Bu Dena. Last but not least, to give the comments and to announce the winner, Pak Rahmat Hidayat. Your time, share, sir.
Okay, thank you, Sasha. Okay, I think Bu Dena give some advice for you for debate tonight. So I don't want to give you more advice because it's enough from Bu Dena. So, but maybe if one of you go to final, I just ask you, okay, you have to counter your opponents. So don't to focus with your draft. So because you more or less just read your draft. So it's a debate, so you have to counter your opponents. What they said, you have to counter, and you have to give your arguments. Okay. For tonight, I have different choice from my partner, the other adjudicators. So they have choose from negative house, but I have different choice. Okay, so the best speaker in my version is the second speaker from affirmative house. Congratulations. Okay, so we come up with the same conclusion tonight for the winner. So where is the supporter from the both side? Okay. So the winner for this evening debate is from the negative house. Congratulations. Okay. So I hope you will be better in the next stage. Thank you, Sasa.
Thank you, Pak Rahmat. So congratulations to Sandstorm for making it to the top 4.
Alhamdulillah.
Thank you. And also, it's a very good game, Super Balikpapan. You're making it this far. I hope this gives a good experience and listen to the advice from the adjudicators to be better. And you can join next year. So I hope everyone is having a good time for tonight. I hope everyone is having a good rest for tonight. I hope everyone is having a good weekend too. So see you in the next round. Bye-bye. Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you.